Hey guys, and/or welcome back. So in the delivery room, you may hear a staff member say to the baby, hey, come on, let's cry. I need you to take a big cry. I need you to take a big breath. And that's because, like I explained in one of my previous videos, if your baby's crying, that lets us know that your baby's breathing. So initially, we're doing a lot of things. We're hands-on. We're trying to stimulate baby. We're trying to dry baby off so baby doesn't get cold. So we need to make sure that the baby's crying so that we can know that the baby's taking some good breaths in. Within a couple of minutes, we'll get our stethoscopes out and we'll listen to the lung sounds and things like that. But in those initial first seconds, as long as your baby's crying, that tells me that your baby is breathing. Now, also, that plays a role in how we score baby. So we use what's called an APGAR score. That's APGAR. And crying is one of those components. Now, a perfect score is a 10. That's pretty unusual to get a perfect score of 10, though. It's more common to get a 9 or maybe even an 8, and those are good scores. 7 is an okay score, and anything less than that is when we kind of start to worry and try to do some extra things for baby. So we use that score to communicate to everyone how well baby is transitioning after this delivery. So, like I said, if it's a score of a 7, 8, or a 9, then we're like, okay, baby did good. We can go about our day as usual. If it's less than that score of a 7, 8, or a 9, then we know that we need to be doing some type of interventions to kind of help baby along. So, in the beginning, we just ask baby to cry, and it's not because we're trying to be mean. We're trying to get those lungs to expand. So, in utero, in the womb, they're in a fluid-filled environment with the amniotic fluid. So it stands to reason that their lungs have fluid build up on them as well, but that helps them to survive in that fluid-filled environment. Now that they've been born, they're no longer in that environment. They no longer need that excess fluid on their lungs. So a good cry also helps to squeeze those fluids out and gets them to take a good deep breath of air in, and that helps with the oxygen exchange. So we want baby to cry. We want to get those fluids out. We want to suction baby, whether it's with the bulb syringe, the little blue ball suction, or if we actually stick a tube down and just kind of like suck out all the fluids that way. We just want to help baby get as much of that fluid out as possible. Now, 9 times out of 10, it's not all going to come out right at delivery. So you may get what I tell the parents is a loogie later on in, the middle of the night or after a feeding or anything like that. And that's normal, that's common, that's the remaining fluid coming back out, and it's a good thing. We want that to happen. So in the beginning, yes, we want baby to cry, we want baby to kick and scream, we want baby to be very active, because that tells us that baby is thriving and is doing very well, and we can just kind of stand back and let parents and baby bond and, all the joyous moments of having a baby. So vaginal delivery versus a C-section delivery. So with a C-section, it is more common for baby to keep some of that fluid buildup, and it's mainly because they're not getting a good squeeze. So with the vaginal delivery, you're pushing baby out, you're squeezing on the rib cage with every push to help get some of that fluid out. So C-section delivery, they don't get that chance to have that pulsating, squeezing pressure going on. So a lot of times you'll hear us say at a C-section, oh, baby's lungs sound wet. That doesn't mean that it can't come out. It'll still come out. It'll just may take a little bit longer. In those situations, sometimes we may end up giving baby some extra oxygen just to help make up the difference for what they're not able to pull in with a deep breath. So I usually tell parents, and before the delivery even happens, I usually have a saying that if I'm not worried, you don't get to worry. So I've had parents ask me, hey, are you worried yet? And I might say, I'm concerned, not necessarily worried. So that just means that I need to do some things to get baby along, but we should be a-okay. Now, there's a whole team there, so if anybody feels uncomfortable, then we may bump that concern up to a full-blown worry, and then at that point, we'll have a discussion, we'll have a talk. But in most cases, the answer is Nope, not worried. Here you go. So, hope this helps. Hope you learned why we ask baby to cry at delivery. That tells me that I've done my job, and I will see you guys next week. Bye.